suicide among teens is the second leading cause of death. That's in kids ages 15 to 19. And in the United States, male adolescents commit suicide at a five times greater rate than females, although females make more suicide attempts. So I think that gives you some sense of the scope of the problem. I am going to share my screen so you can see my beautiful PowerPoint slides. And yeah. Okay. So I'm not going there though. That is not the slide I want. Hold on. This is at the end of the presentation, not the beginning. Let me go back. Okay, there we go. Okay. So talking about the difference between males and females, the difference is in lethality, even though more females attempt suicide, female teens, than males. Males tend to use methods that are more lethal. So why is suicide the second leading cause of death? And there are a bunch of variables, and those variables have really changed over time. We know that high school ages have a lot of social and academic stresses, a lot of pressure on kids to be thinking about what's next in college, and that starts very early. That starts in middle school. Social stressors, all kids are finding out who they are and figuring out what they want to be like, how they want to be different than their family, or how they want to be the same as their family. And they're just kind of figuring it out and going through life. And that's very, very stressful to think about things like, am I like my parents? Do I believe in the same things that they believe in, or do I believe in different things? Do I want to live my life in a different way from my parents? And those stressors are huge. Also, the fact that the most important person to a teen is their peers. Well, their peers are in the same place they are and have the same adolescent brain that's developing, so might not be the best decision makers. And yet that's where our kids tend to get their information. So there's another reason it's second leading cause of death is the availability of alcohol and drugs. Kids are experimenting with alcohol and drugs, and I'm not saying that all kids are, because many aren't, many don't, but many do, and often their parents have no awareness at all that that's the case. And also another thing is social media, because social media allows kids to interact with each other, communicate with each other without having to face each other. And so it's easier for kids to say really horrible things, really bullying things via all the million ways now. I mean, I know about Instagram and Facebook and things like that, and I'm just old-fashioned and don't know really what's going on. But I do know that all of those platforms are a screen, so that the kids, when they're talking to each other, aren't face-to-face and can say things in a way that they wouldn't normally do. So along comes the pandemic. And in May 2020, it was documented that the emergency department visits for suspected suicide attempts began to increase among females. And then during February to March 2021, the suspected suicide attempt visits were 50% higher among teens than during the same period in 2019. So that's huge, 50% higher just over the course of time. And the only thing that's very obviously changed during that time was the pandemic. The suicide rate, attempted suicide rate, decreased a little bit, quite a bit less actually for boys, but that's because the rate was higher. They think that that's because the rate was higher in the first place. So pandemic isolation, lack of routine, kids being unable to participate in their sports, which we all know is excellent for mental health, but also in other activities, like there were no drama clubs and everything else that goes on that kids really enjoy doing and really help them to form their emerging identity. All of that was gone for a good length of time. So we're starting to see now kind of the fallout from that, because the kids are back at school. Many of the kids are back at school, and we're hearing from parents and we're getting phone calls, and every mental health professional that you know of is overwhelmed and swamped by the amount of people who are reaching out and saying, I thought going back to school was going to make everything okay for my kid, and it's not. Things are not okay. So how do you identify somebody who is suicidal? Now, this would be the same in most cases, whether this is an older adult or a teen. Somebody who is talking about suicide, looking up information about ways to die, is obviously in incredible pain or distress that would be noticed with crying or just being really despondent, not able to get up and go to school. Any kind of change in behavior like that, because some kids don't like to get up and go to school and they don't like school in general. And so that might not be a change in behavior, but anytime we see a change in behavior like that, that can be a warning sign that a person is suicidal. Increased irritability or conflict. If a person just feels wrong in every part and every aspect of their life, that may be the way it manifests itself. But on the other hand, it might be withdrawing or isolating, staying away from friends, not reaching out to talk to you, or not reaching out to talk to anybody in the family. Alcohol use is another indicator that a person might be suicidal. So it's a risk behavior, but it's also an indicator. Alcohol use, and then other drugs too, which are usually less obvious. It's easier to figure out whether or not a kid, not easy to use, but easier to identify whether or not a kid is using alcohol, because you're going to find empties and you can smell it on their breath and things like that. The other one is saying goodbye. And sometimes saying goodbye doesn't look like saying goodbye. It's a person who appears to be okay, and it's just saying, popping in to talk to somebody. And when you look back on it after, and you see after a suicide attempt has been made, you look back on it and say, that was actually a goodbye. Other warning signs are just talking about killing oneself, talking about feeling hopeless, talking about being a burden, talking about saying things like, I don't have a future. I don't have a reason to live. And if you talk to someone who feels like that and you try to pull out from them what is their reason for living, they may not be able to identify it. Feeling trapped and not being able to change things in one's life, and talking about that. And again, that identification of just really unbearable pain. And I see that in my office when someone comes in and they just are really thinking about, this is the only thing that I can do to feel better. And it shows up in just crushing pain where you can actually physically see it, that the person has challenged just standing up and holding themselves erect. So more warning signs are humiliation or shame if a person has been bullied. And again, that's really common on the internet. I've known some kids who were just really, really harassed by all kinds of friends on social media. And I'm thinking about a situation that happened to one of my own kids, and it was quite a few years ago now, probably 6 or 7 years ago. But what happened was my daughter had gone on a date or something with some boy, and a bunch of the girls at her school decided that that was not acceptable. And so they came at her from all different directions on all different platforms. And all of a sudden she was just so, filled with shame and doubting her own ability to be worthy of living because of these kids just came on with all of the "you're bad," and really doubting whether or not she had done something really wrong. So, but that's very, very common, and it's very easy to do. And when we talked to the parents of the kids about this, they were like, "Oh no, that's not anything my kid would do." Well, I understand that feeling, but I also, when my kids were younger, would never be the mom who would say, "No, not my kid, not ever," because you just don't know. So other warning signs: agitation or anger, just outbursts of anger, unable to control emotion, if that's different from what happens normally or typically. And then relief, sudden improvement, kind of like the friendly goodbye. If a person is all of a sudden feeling better and um, seemingly, back to their old self, it could be that they have made the decision to die and that they're actually relieved with that decision. So more warning signs. So the risk factors for suicide are kind of complicated. And because of that, I think you probably often hear about things like, well, the person's therapist missed it, or the parents missed it. No one was able to notice what was happening until things had gone too far and it was too late. But risk factors can be behavioral. They can be increased use of alcohol or drugs, as I said before, searching for ways to die, withdrawing, as I said before, isolating, sleeping too much or sleeping too little, which are also signs of depression. Giving away prized possessions. I didn't talk about that, but when somebody all of a sudden doesn't need any of their stuff, they perhaps are, following Marie Kondo and deciding that they're going to be minimalist, but they also may be considering suicide. And the next part of it is, after looking at behaviors, we look at mood. And so a person is more likely to be considering suicide if they're depressed, if they're experiencing anxiety, if they have, just a kind of loss of interest in all the things that they used to enjoy. And health concerns are also risk factors. Depression, a history of substance abuse problems, serious mental illness like bipolar disorder, or a diagnosis of a serious mental illness, because that often leads to a feeling of hopelessness. Like, okay, I'm 15 and I have bipolar disorder, or my doctor thinks I have bipolar disorder. That is a very hopeless feeling, because it looks like a long life of a lot of challenges, which may or may not be true. Let's see what else. Personality traits: a person who is more aggressive or more moody by nature, and also a person who has difficulty maintaining relationships might be at higher risk for suicide. A person who has conduct disorder, which would be just the inability to follow society's rules. But even a person who has anxiety disorders could be at risk for suicide. And then there are physical health conditions such as a traumatic brain injury, a history of concussions, we now know, is a risk factor for suicide. Another risk factor is, or other risk factors are environmental, like having access to guns. Kids can't kill themselves with guns if they don't have guns. Having access to drugs, and I'm not talking about drugs that a person might go down onto the street to buy, but drugs that they find in their own home, drugs that they find in their friends' homes. Kids can easily, and this is how a lot of kids really start using drugs, as they go into medicine cabinets in their parents' medicine cabinet or in their friend's parents' medicine cabinet, and can find access to all kinds of things. So that's another environmental risk. A kid who is under a lot of stress and has a long time history of experiencing bullying is much more likely to consider suicide. Family divorce, family financial crisis, such as what many people have experienced during the pandemic, where people have families who've been financially stable, have lost their source of income. A loss of a close family member can also be a risk factor. And then the other one is exposure to another person's suicide, or sensationalized accounts of suicide, something that you might see in a movie. A lot of times when somebody dies by suicide, they become almost mythical, or actually when a young person dies at all, they become almost mythical, and people are praising them perhaps in a way that is unrealistic and really doesn't reflect how they really were in their own life. But that's what we do when we lose a child. And then the next section of risk factors are historical risk factors. And that is, a person is high risk if they've had previous suicide attempts, if they have a family history of suicide, or if they have experienced significant childhood abuse, trauma, or neglect. So we can talk about that. And please ask questions if you don't understand what I'm talking about with any of these things. So, protective factors. It's not all bad. We do have some protective factors, some things that we know about. One of the things is access to mental health care, and a family who's proactive about mental health care. And that's something that's really important at JFS. We really focus on accessibility and making sure that we do everything that we can to get a person who reaches out to us into counseling, and do whatever we can in terms of finances, getting a therapist available to them. And we've just increased our team, so we have even more possibility of accessibility. But accessibility is a really big issue in the United States with the way our insurance is structured. And so people have different ability to access care. Another protective factor is feeling connected to family and community support. And so feeling connected to family is really important, and that's what we really want. That's ideal. And feeling connected to an extended family is also really important. But it's also important that kids are connected to teachers and coaches and other people who are in the community, so that they feel a sense of belonging. Another protective factor is a person who has good problem solving and coping skills. And we know that there's a really broad range of people who are able to problem solve and cope with emotional stressors. And some people are a lot better at it, and some people are, more challenged. And also we know that in those years when our kids' brains are developing, we can't really be sure about what kind of problem solving skills they might use, what kind of coping skills, or even how resilient they might be at any given time. It's really important for us to limit access to lethal means. And so that means, to me, I don't want to go on a political soapbox, but keep the guns away from kids. Do not have any accessibility to any kind of weapons for kids. Very sharp knives, other than cooking knives, knives that are used for hunting, guns, prescription medication, and even alcohol should be kept in a home where their teens should be kept locked. And that's not because you don't trust your specific teen, but because you just don't know what a kid will decide to do at any given moment, especially if they're feeling like they don't have the ability to continue living. So, and then the last one is the cultural and religious beliefs. And this is a kind of gray area, because it is a protective factor to be part of a culture or a religion that does not agree with suicide. However, that is something that I would tread very lightly and not bring up actually to my team. And we'll talk about this in a minute, but they may be making choices to move away from that. And it may actually be the intensity of that cultural and religious belief that is pushing them in a direction of wanting to be different, or feeling like they can't belong, they can't fit in. And we see this in different faith groups. but it's, again, it is also a protective factor because being a member of a faith group makes a person feel like they belong and that that's a place for them. So the next thing I really want to talk about is the difference between non-suicidal self-injury and suicidal intent, because this is something that's really misunderstood a lot, even among mental health professionals. People who want to end their life are not in the same place as somebody who wants to engage in self-harm to cope with their life. So self-harm is related to ways of coping with your life, whereas suicidal intent is a way of ending their life. And I just think that's a really important difference. Sometimes, and it is also true that sometimes we see non-suicidal self-injury as an indicator that or a risk factor for suicide, and it may be, but in most cases it is not. It is a person who has come up with what we call a maladaptive coping strategy for managing their emotions. So the term for that is non-suicidal self-injury. And this is everywhere. If you are out on the internet looking at any kind of social media for kids, there are videos of self-harm and talking about self-harm. Kids know about this and they talk about it. And all kids know, all teens anyway, know other people who are engaging in self-harm. Self-harm can be so many different things. We think of it most often as cutting, but it can be burning, it can be pulling out hair, it can be milder things such as skin picking or scratching. The reason that kids engage in self-harm, well, there are a few reasons, and we're not quite sure that we really understand the mechanisms behind it. But what people say is that self-harm reduces negative emotions. It helps people to feel something when they're just feeling numb and they don't feel anything at all. It helps people get out of social situations. And it also can be a perceived cry for help. You know, if a person has scars up and down their arm or active cuts, then people are going to notice that and hopefully provide support for them. Yeah, I'm thinking about that because I do think that this is such an important difference. 15% of teens and 17 to 35% of college students say that they have engaged at some point in some kind of self-harm. So this is something that I think is really important for us to pay attention to. I think it's very scary to parents when they find out that their kid is doing something like this. And it's because we tend to equate that. Well, first of all, we don't like to see our child hurting themselves, but second of all, it's because we tend to equate that with suicidal behavior. As far as non-suicidal self-injury, it is comparable for males and females. It's not different. Kids tend to copy each other and do the same kinds of things. So if something is working for one person, they might talk to their friends, or they might have learned about it from their friends and decide that that's something that they're going to try. A lot of kids also tell me that they try some of these things and they're like, I tried that because I thought it would be helpful, but it just really didn't work for me. But what I really want to say about that more than anything is that non-suicidal self-injury is a coping behavior. And there are a lot of theories about how that is a coping behavior and why that actually works or makes a difference. And the different theories are what leads to the different ways that we might treat a kid or a teen or an adult who is engaging in non-suicidal self-injury. The one that makes the most sense to me and that I have learned about in my training and is also the perspective that I use in therapy with people is that when we are feeling some intense emotions, some really extreme emotions, I just saw someone recently who was just experienced so much sadness and so much pain. And one way to hijack the brain and get away from feeling that is to do something like injure yourself, because what happens then is the brain it takes a break and is no longer thinking about this terrible thing that has happened or is continuing to happen, and thinks for a few moments about the pain that has been inflicted. So that's the theory that makes the most sense to me. And because of that, the kind of coping behaviors that I teach teens and adults who are engaging in self-harm are other things that are very unpleasant to do, but that are not actually dangerous. And so I ask people to, if in those moments when they're just feeling overwhelmed by emotion, to do things like put that really hot Chinese mustard powder on the end of their tongue. And trust me, it is horrible. It tastes awful. But what it does is it pulls the brain away from the negative emotion for just a few minutes. Frank's hot sauce works, but not as well. Some therapists talk to kids about snapping a rubber band on their wrist. I don't think that's that effective because I don't think it really hurts enough. And kids are very well aware that that's not going to make the difference. But yeah, so that's what makes the most sense to me, is that the brain is overwhelmed by using the primitive part of our brain, primarily the amygdala, with the really challenging, horrible emotions, and that the functioning of whatever happens to cause the pain pulls the thinking away from that to the part of the brain that engages in more thinking, and a person can hopefully calm themselves or feel better in a few minutes. So how do you bring up the topic of suicide? I was talking to my 34-year-old son about this the other day, and he said, and I told him I was going to be talking to you about this. And the thing he said is, first of all, you need to know that what you're going to say will not be perfect. You're not going to be able to say the right thing. But the fact that you're willing to sit down and talk about the really scary thing and to confront it head on is going to make all the difference. So it's a misconception that talking about suicide puts an idea in a kid's head. Kids are very well aware of the possibility of suicide, and we're not going to give them that idea by asking them about it. Our own fear is a really important variable in bringing up the topic of suicide. It's a really scary thing to ask your child if they're considering dying or if they're thinking about it. And it's a really scary thing if they answer yes. And so we have our own fears about it. And this is even true with all kinds of mental health professionals. I have colleagues who really, really, really don't like to talk about suicide with their clients. And yet it's absolutely crucial that we do that. It's also really important that we don't use euphemisms, that we talk about suicide, that we talk about dying, that we say things like, are you thinking about dying? If we use euphemisms such as, are you thinking about hurting yourself? Maybe we're talking about something completely different and we're not actually talking about suicide at all. So it's really important to be very, very clear about it and use the correct terms. It's really hard not to invalidate a teen when they talk about their pain and the experience of it, because we might see that, sure, this is just your, high school friend or boyfriend or whatever. And we know that life moves on and that things are probably going to be fine, maybe even tomorrow. But it does not feel like that to the child at the time. And so it's really important to validate their experience. You feel like this. And then say things like, it must be really, really hard to feel that way. This is one area where it's really, really hard to make a mistake. And most of the time our kids are forgiving. But I recently was listening to my daughter talk about something I had said to her. And she said, oh, well, I told my mom about that. And then I was worried about it. And she laughed. And I was like, oh, no, I'm a therapist. I did not laugh. But I thought about it and I was like, well, I guess I didn't actually laugh, but I thought, well, that's not going to happen. That's kind of, what are you worrying about that for? And that was exactly the opposite of a helpful thing to do. So bringing up the topic, ask kids, what's happening? Are you okay? You might say, I heard about so-and-so, or what's going on with them. Are you okay? You might see change in their behavior. And so the question is, are you okay? But then ask the next question too, especially if you're getting a sense that the child is not actually okay. And the next question is, are you thinking about dying? Are you thinking about not being here anymore, which is often the way kids will phrase that. I'm thinking about not being here anymore. And so then I take that further and I say, so not being here because you just don't like what's happening right now and you think it's too hard, or you want to die. So ask the questions and be really specific. Listen carefully to the answers. It's too easy for us to jump to our own judgment and our own ideas about what things will mean. And it's also really easy for us to be thinking about answers or ways we can fix the problem. We can't fix the problem. We can offer support and a listening ear, but likely we're not going to be able to get the person who just broke up with them to change the problem. We're not going to be able immediately to change clinical depression. So listen and don't judge. And that's really hard too, because, if a kid is using alcohol or something that we really would wish that they weren't using, and we become aware of that, judging them, telling them that that's not acceptable to us, telling them that that's not allowed, is not okay, is only going to shut down the conversation. It won't keep it going. So without judgment, and trust me, I know how hard that is. And as I said a minute ago, we can't fix this. We can't change this immediately. So we need to just allow ourselves to sit with this really difficult way our child is feeling. And that I think is the hardest thing of all. It's okay for us to go later and go into the bathroom and cry. But we try really hard not to do that when you're with the kid, because what you want is for the focus to be on them. But it is okay to talk about things like how scary this is for you to hear this, or how sad it is. And it's even fine to talk about things like, I would be so sad if you died. And that's actually the way I talk to people in my office. And I say, this really matters to me. I would be very sad if you died. That would not be okay. And it's fine to use that kind of language. So what if your teen tells you that they are suicidal? It's the same thing. Remain calm, listen to what they're telling you. Try to understand, knowing that you probably will not be able to fully understand. Tell them how brave they are for being honest and talking to you about it. Make a plan to consult with a medical or mental health professional. But any teen who expresses significant thoughts of suicide and has a plan and has the means to conduct that plan and is intending to do that needs to be seen immediately. And so what I tell parents is, put your kid in the car and drive to the hospital if that's safe to do so. If not, you can call the mental health crisis team. You can call the police if you need to, but they do have to go to the hospital, because we are not, none of us, even mental health professionals, are not qualified to assess and support a person who is actively suicidal. So that is what needs to happen. My daughter was just talking to me about this the other day about, I can't believe you did this, Mom. But she was saying to me when she was a teen, probably 14, I am going to die if that happens. And so I said, are you serious? Like, you really are going to die? Like, you're not just being, dramatic. And she said, no, I am going to die if that happens. And so we talked about it, and she was insistent that that was the case. So I said, well, let's go over to the hospital and just make sure, that you get assessed by somebody who really knows. And we got in the car and we drove all the way down Elmwood, and we had a really good conversation in the car. And decided that she was not actually suicidal, that she was just overwhelmed by the thoughts of this thing happening. And so we ended up not going to the hospital. But what we did do is get in touch with her therapist the next day. If you're not sure about what to do and you're not sure about how to have a conversation like this with your teen, call the National Suicide Prevention Lifeline, and it's on here. It's 800-273-TALK. So that's 8255. That's an important number to keep handy. And then finally, what if your child knows someone who died by suicide? It's important to listen, and to listen to the teen's understanding of what it means to them that this person died this way. Open up the conversation. If you're driving in the car, say, wondering how you're feeling about this. What are your thoughts? What was it like to go to that funeral? Tell me about the last time you saw this person. And open conversation, and keep that conversation going. Take it seriously. Some of the things that our kids will say to us sometimes don't seem that serious to us, and we're thinking we're taking it lightly. Take them seriously and really listen. Allow them to have time spent with their peers. What happens when a teen dies is kids usually cling to one another, and that can be really healing and really helpful. But at the same time, watch out for substance abuse, because that is a time when kids are getting into the alcohol cabinet in a home, or finding alcohol in other ways and using that alcohol to help themselves to feel better in the moment. Although I always tell them that they might feel better in the moment, but they will feel worse the next day. So it's not a helpful behavior, but watch out for that. And finally, contagion effect. And that's really important. When someone dies by suicide and it's public, people in the community know about it, especially with teens, there tends to be a contagion effect. It happens when a public figure dies by suicide. Even when I was working in a college and Robin Williams died, even though he was not what we might think of as a role model for college students, all of a sudden we heard a lot of suicide talk and a lot of awareness of that as a possibility. And the way we talk about that is that, yes, that's a possibility, that makes you feel better, but we don't really know what happens after we die, because no one's been here to tell us that. So contagion effect is something to look out for. And it is true in the mental health community. If we hear about a suicide of a sports figure, or a musician, somebody who's famous and well known, or there is a high profile suicide in the community, we're watching very carefully for contagion effect. Okay, so that is the end of that part of the presentation. And now I want to give you a chance to ask questions, because I know I covered a lot of material really quickly, but I'm not back on the PowerPoint yet. I'm not back on the Zoom call yet. Here.
I'd like to say thank you for doing this presentation today. Can you hear me?
I just can't see you yet, but I'll be able to.
So I just wanted to say thank you for doing this presentation. I was in middle school and high school, actually, in the Brighton School District, and I had about 4 or 5 people I know that did the things that you were talking about. I have to be careful because I've got young ears around me, and I've been keeping